Good evening, everyone. This is Meldita, and I'm back here at my YouTube channel, Meldita's Info Corner. And this is my Facebook, joanregacho@yahoo.ca. Okay, this is a continuation of our kidney transplant. This is a donor kidney in green, a donor kidney. We took a tissue here from the kidney, and that one cell is called the nephron cell. And this is the glomerulus, the tubules, and this is the filter of the kidney. So the question is, why does donor kidney fail to work effectively or fail to work completely? I put 5 reasons here. We have the donor kidney rejection, the donor kidney infection, the donor kidney dehydration. We have also the chronic allograft nephropathy, and we have also the co-morbidities here. So let's start with donor kidney rejection. We have here a non-compliant patient. So as the patient takes less or no anti-rejection medications, the patient's immune system gets activated or will wake up, and then they will attack the donor kidney. Okay, so this patient is non-compliant because he is not taking his medications regularly. He forgets taking medications. He stops taking medications, not refilling his medications. So this is now what happened. He developed signs and symptoms of rejection. Okay, for the symptoms, he will feel them. So there's a decreasing or no urine output so decreasing or no urine output. He'll start gaining weight, so 1 to 2 kilos in 24 hours. He will have swelling of hands, eyelids, or legs. Increasing creatinine levels from his blood works is a sign, not a symptom. He develops fever greater than 38 degrees. He has tenderness or pain over the transplanted area. He will have flu-like symptoms such as chills, nausea, vomiting, diarrhea, loss of appetite, headache, dizziness, body aches, and tiredness. Okay, loss of appetite. So these are the symptoms. The signs that will show will be from the blood works. That will show increasing creatinine. The urine will probably have positive albumin, possibly, because this patient is non-compliant. And the tacrolimus levels may go down as the patient is not compliant with the schedule of his blood works. Okay. So the symptoms he feels, I mentioned that the output is decreasing or no urine output, gaining weight, swelling, fever, tenderness, flu-like symptoms. Well, not all of these symptoms will be felt by the patient, maybe some of them, but their blood works reveal rising creatinine, or the urine may be positive albumin, or maybe the blood works shows tacrolimus levels decreasing. Okay, so somehow we have to manage the rejection. So the patient will go to ER immediately. They will do a stat or immediate lab works, stat or immediate anti-rejection medications by the transplant doctor. So they will give here an IV steroid, methylprednisolone, or it could be the antibodies, which is the ATG or anti-thymocyte globulin intravenously. And the transplant doctor will change or adjust one or more of the anti-rejection medications. Okay. So how we gonna confirm the rejection is through, biopsy. So they will take biopsy from the patient, okay, and they will take a piece of tissue from the kidney donor or the donor kidney, and then this will be guided by the ultrasound. Okay. So how about donor kidney infection? So here we have a compliant patient. So as the patient takes all his anti-rejection medications, the patient is compliant. the patient's immune system is weakened or decreased. So this is the purpose of our anti-rejection medications. But there is a but here. But there's a risk of infection to happen if the patient is not careful. So we have a patient here that likes to go to the, to join some crowded areas, not wearing his mask, not observing some of the precautions. So unluckily, he will contract one of these infections. So infections could be bacterial, viral, fungal, and other infections. But I put here two kinds of infection. Okay, we have infection without symptoms, and we have infections with symptoms. So infection without symptoms, the patient does not even know that he has infection. But luckily, through blood works, we see that there are some abnormal blood works. Let's say the patient has UTI, increased white cell count, okay, probably from the CBC or could be from the urine collected. Okay, so if they found that the patient has, example, UTI or urinary tract infection, the transplant team will call the patient and prescribe antibiotic orally. If there is a positive cytomegalovirus, this is a virus that will also damage the transplanted donor kidney. Okay, so the transplant doctor will call the patient and start him on antiviral medication orally. Okay, so if it's UTI, that's bacterial, so that's antibiotic. If it is viral like cytomegalovirus, that will be antiviral. So this patient does not need to go to the hospital. He will just take these oral medications and he will be notified by phone, because the transplant team, they know, these members here, they know the results, and they will call right away the patient if there are some abnormalities. Okay, so we have here another infection with symptoms. So the first one that I just mentioned is infection without symptoms. The second one is infection with symptoms. Okay, so usually prior to discharge, the transplant doctor will tell the patient that if he feels something unusual, he has to go to emergency right away. So he knows that one. So let's say this patient is having persistent cough, fever, frequent diarrhea, and so on. So he knows that he has to go to emergency or to the hospital right away. They will do a stat blood works. And if it is bacterial, the transplant doctor will start the patient on antibiotic. If it is viral, antiviral medications. If it is fungal, then antifungal medications. So if the patient goes to the hospital early, there's a chance that the stay in the hospital is shorter. But if the patient goes to the hospital late, there's a chance that the patient will stay in the hospital for 2 or 3 days because of some complications. So the earlier they come to the hospital with the early, start of all these symptoms, the earlier they are managed and the earlier is the discharge. The longer they delay or anything, there will be complications. So it's not good. We don't want that thing to happen because we don't want the bug or the microorganism to attack our donor kidney. Okay? That's about it. And the second video will be about donor kidney dehydration. Okay, thank you.